Hey everyone, thank you for joining us. Today is August 18th. Well, last week we brought to you a lot of our singing your praises, praising our team members for the hard work they've been putting in the past couple months. So today we figured we would dig into the deepness of these stats. So Lee, do you want to tell us about our hospitalizations and where we stand as far as that goes?
I will. We focused on people last week. Today we're gonna go numbers, 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 and so I'm happy to report today that we had a few discharges. We had
Yeah.
6 discharges today, and we're at 33 inpatients. 18 people remain hospitalized in the ICU, and 15 in regular med surg rooms, and also so that's a little bit of a down step off
Yes,
the
definitely from
plateau.
last
We're
week.
happy about that, and we have our 7-day average went below 50 when you add in today's lower number of tests. So a good trend. Stay focused.
Absolutely. And so we have heard the hot topic of capacity and hospitalizations going around all around the nation, how that's kind of been an issue. Let's talk about our facilities team. How many rooms were we able to surge up with and create negative pressure?
So a big shout out to them that we have rooms normally that are set up like this, but with our surge capacity, we added rooms that could do that, and they added manually 49 more rooms that were converted to negative air pressure. So
And we're prepared to do
we
more,
appreciate
right?
that. Absolutely, they could if we need to. So they've done a great job there.
Yes.
Very
From the
happy
very
with it.
beginning, I know everyone's heard about vents. And so, how many vents or how many patients have we had that required a vent?
So we have had 37 people come on a vent, be managed, and make it off the vent. When this first started, you heard stories about people being on the vent and not coming off. But I'm very happy with our ICU team and the team of critical care physicians, and with the things that they learned early on, and with proning and things like that, they've been able to manage 37 people that were on the vent off of it who have now successfully recovered after being on the vent.
That's
So
amazing.
that's pretty cool.
Kudos to the team for that. So you brought it up. Unfortunately, we did have some deaths.
We did, and I don't like talking about that, but I think in our efforts to be transparent, we have to share. We've had instances we've dealt with. We met the 50-person death mark, unfortunately. We've had some people that came in that they were so far gone with it there was no hope, and we had some that just had so many comorbidities that they just did not have a fighting chance against this disease. And people say that hospitals try to code people as COVID death. That's not true at all. There's no benefit to doing that to a hospital, at least not for us that we see. But there have been people that would not have died if it were not for this disease. That's not to say if they would have gotten the flu, in a bad case of it, they might not have made it. But the flu would have been the cause of death in some cases, and in this case, COVID has been the cause of death.
Right. I know many people who have died from similar ailments that just the one thing that knocks them over the edge. But
Very unfortunate.
I think that another thing that I think that's helped with the death toll recently has been our treatment plans with
Yes.
remdesivir.
Yes, and as of today, we have given 557 doses of remdesivir, and that coupled with the dexamethasone seems to be what we believe for most cases. Every case is different, but in 90+% of the cases, it seems like that is the best, most appropriate treatment. There's a lot of bad information out there about things on the internet about what does the hydrochloroquine do, what does this drug do, what does zinc do. Ultimately, we believe that the treatment plan that our clinicians have used, evidence-based medicine, and also in concurrence with Ochsner and UAB and
Mayo
other
Clinic was
places
I think the main
like
study that we did with remdesivir.
Absolutely, we agree with those institutions.
And it's
We have follow
FDA
with them.
approved.
Yep, and so we're happy that we've been able to do that.
Yes. So as far as testing goes, what are our numbers going on?
So as of today, I show that we have 2,647 positive tests. That's insane. Out of 23,509 people tested. So a lot of tests performed. I'm proud of the lab team for what they've done there. That's about 10.7% positivity. We had at one time we were as low as 8. I think that's I'd like to be below 10. I think most places would. But it's a lot better than other places that are at 12 and 20+%. So overall, that's not a bad percentage. That also means that almost 90% of people that are tested don't have it. So that's good. And then the other statistic I'll share in that regard is out of those 2,647 people, 98% 99.2% of those are recovered. Thanks to the amazing care of the people throughout our system, from primary care to the ER to med surg and ICU and everywhere in between.
Absolutely, and testing's still going strong. We have less than 48-hour turnaround time, so even though the numbers seem to be slowing down, we still encourage everybody, especially with symptoms, to go to our clinics. Our hotline is
Right.
still open, and shout out to our clinic team who had hit the ground running with those hotline calls and still continue to today. How many
Absolutely.
of those do you think we've done?
14,436
Wow.
hotline calls that Jason, the primary care team, and docs have fielded. So, a lot.
Absolutely. And so supplies were an issue at the beginning. People didn't know if we had enough. Masks are now mandated across the state and other states as well. How many masks have we gone through as a health system?
495,635 masks.
So we're being safe.
That's a tremendous amount, and I, like everyone else, long for the day when we don't have to wear masks. But we'll get there. But right now we have used a lot of them. That's a unconscionable number.
Well, with supplies comes cost. How much has this contributed to our finances?
So it's hurt, no doubt about it. But just like other businesses out there, this is America. We're tough. We'll figure out a way to get through it. It's cost us, several $1 million,
Mm-hmm.
and it's challenging. But we're just gonna keep our nose to the grindstone and keep doing what we do and keep working hard. And I'm confident that in spite of the costs of this, that we're gonna be okay.
Right, and despite of costs, there's no cost to improving health and saving lives every day, which is our mission. There's no cost into getting the education out there that you guys need, that our community needs very much so. Which brings us to marketing, which is my sort of area, and the team that leads that up, Shannon Wall. Her team had put together over 160,000 flyers that were distributed
Yep.
across the county into schools, into workplaces. Just trying to
Very
get
proud
the
of
good information out there, and then also Facebook.
Yep,
You all
exactly.
watching us right now.
That's right. So 160,000 flyers is phenomenal. You, Shannon, Georgia, Melissa, the whole team getting those out to the community, I think has made a difference in helping to educate people, along with our navigators
Right.
and the hundreds of calls they've made. But ultimately, the 4,422,000 Facebook views, it's a lot, and we would appreciate. I think one of the things, the reason this is good is because it educates people. If there's things you need to know, we have worked really, really hard, probably harder than people realize, to make sure we put accurate information out there for the public to see. And so the best source, people ask me all the time, what about this? What about masks? What about him? It's all on the Facebook page, and that's been our goal. It's on the website too, and
Yep.
that'll direct you there. But events, blood drives, where to go, hotline number, you name it, it's right there in one place on the Facebook page. And I appreciate everybody throughout the system who has helped give us little pieces of information to help
Right.
make it so
100%.
good.
It is
So
definitely a team effort, and thank you guys all for liking and sharing and making sure people
share it,
know
invite your
the
friends.
facts and not
You
the
know,
fears.
the more people that are educated about the details, the more it can stop the spread. The reason to share it is not to promote Sand River, it's to promote information sharing and education. That is the objective.
Right, and to stay up to date on what's happening locally here,
Absolutely.
not in places that don't have any effect on our numbers. So, which leads us to the events, of course. You can go to our Facebook page and look at the events coming up. We have 2 blood drives here within the hospital for our employees to donate blood, and also we have 2 next week, one in Gaucher and another in Ocean Springs at the Civic Center. And that leads us to plasma. That's kind of been another hot topic as far as donating if you're positive with COVID-19. It has been used in certain research and
So
trials.
if you've recovered, there's still a lot of research going on that, but if you've recovered, please do volunteer to donate. We use an organization, the Blood Center, that helps coordinate those blood drives, and we've done over 24 convalescent plasma transfers. So something we can continue, and if you have recovered, please consider that.
Right.
You never know who it might help.
And all you have to do is call the Blood Center right here in Gaucher, and they'll schedule you an appointment to give blood or plasma, whichever you would like to prefer. And also another thing that we'd like to announce is that our Baby Cafe is up and running now virtually. It's a support group for new mothers or mothers who have some trouble with breastfeeding or just need some advice or just reassurance from other moms out here in our community. So that's going to be every Thursday. You can go to our Facebook page. You can find out how to connect through Zoom, and that'll be every Thursday going forward to help you guys out there.
I want to mention one more number, important number, the most important number. First, I want to give a shout out. I can see on the screen there, Althea Trahan, a retired person that I used to work with here. Thanks for the painting there, Althea. It brings us joy every day. Me, anyway, joy every day. So thank you. And I want to say a big super shout out to the biggest number, the most important number, and that's our 2,612 fearless warriors that are out there every day fighting on the front line to help stop this insidious disease. They are so important, and a special shout out today to the people who are really having it the toughest, I think. Everybody's got challenges, but the emergency department has been really hanging in there. There's a lot of folks coming in. We can safely take care of you, but they've done a great job. Them and the ICU is also very difficult to work in, but they, along with Med-Surg and Lab, many other areas have done great. But special shout out today to the ER and ICU, and want to thank those people for being Singing River strong. So keep that up.
All right, and you guys out there, as you know, stay Singing River strong.
That's right. Appreciate you.
100%.